Okay, so you guys already know what the start of care is. That's the day that the nurse does the initial admission. Each time the nurse goes and does that visit, she always leaves a home health folder. And that's a universal procedure among all the agencies we work with. We work with hundreds of agencies here in Texas, and all of them have the same startup process. So the first thing you want to do whenever you go into the patient's home for the initial evaluation is ask the patient for their home health folder. They should know exactly what you're talking about. So within this folder, this is how all of the disciplines in the home communicate. You know, you may have a PT, an OT, a speech therapist, a nurse, a doctor, a caregiver, 6 or 7 disciplines working with this patient, and they're all coming in at different times. And everyone communicates within this home health folder. So what you want to do is you want to get the folder. Within that folder, there should be some sort of sign-in sheet. And this could be seen as, it may say sign-in sheet, it may say therapy log sheet, it may say vital sign sheet. It should be pretty obvious, and this is where everyone signs in. And so on this sheet, you just fill it out. It's pretty simple. You're putting the date, your name, the vital signs, which we'll go over here in a minute, your discipline, as well as the visit number you're on. So for me, it would be, I'd put the date, I'd put Nate Foreman, the 4 vital signs that are needed, a PT evaluation, and then what number visit I'm on. And once you go in there for follow-up visits, you should see doctors signing in, nurses signing in, OTs, and whoever else is in the home. One thing I also recommend with these folders is you always put your name and phone number on the folder, because if the OT needs you, she'll know where to find your information. Same thing with a doctor. And then vice versa, if you need to contact one of them, that's where you find their contact information. So it's a really good resource for you. It's something that is really important, especially for intercommunication among all these different disciplines. That is something that you want to find the first thing you walk in the home.